Well, good afternoon, and welcome on behalf of the Board of Trustees of the Community Health Endowment. It's my pleasure to welcome you to our annual meeting. What a joy it is to see all of you here with us today. I'm Mike Tavlin, Chairman of the Board of Trustees, and I want to take a moment before here at the beginning of the meeting to introduce my fellow trustees. It's been my pleasure to work and alongside these individuals for the past year and in many cases for many years. Please stand as I call your name and recognize you, and if you wouldn't mind, remain standing until I finish all the introductions. Doug Gans, our secretary. Britt Miller, our treasurer. Tom Beckius. Is Charlene not here today, or Charlene is here today? Charlene is not here today. You're gondering. Judy Halstead. Hi, Judy. Hi. Lauren Roberts. Dr. Mike Molvar. Kim Moore. Allison Larson. Do I see Rick Poore in the room anywhere? No. Dr. Maria Prentice-Lintel. Tina Udell. And Dr. Charles Wilson. Please join me in thanking them for their service to the Community Health Endowment. Kim Russell, Vice Chair of the CHE Board of Trustees and President and CEO of Bryan LGH Health Systems, is unable to join us today. So Bob Ravenscroft, Vice President of Advancement and Chief Development Officer for Bryan LGH, and will be her designated hitter today, and has a few words to say on her behalf. Bob, please join me up here.
Well, the applause would have been much louder if it was Kim. There's no doubt about it. She's big shoes to fill. Well, good afternoon and welcome to Bryan LGH. As he said, I am Bob Ravenscroft. I'm the Vice President for Advancement. What that means here is public relations, marketing, community relations, media relations, and development. So by virtue of that, I am a big fan of the Community Health Endowment and everybody in this room that helps support the health and well-being of our communities. So thank you very much. Now there's two areas I would like to call out, and that's the attention that in this room that is given to behavioral health and the safety net in our community. And why? From a hospital perspective, you see a lot of people getting out of it because the profit and loss statements don't look very good. So there's fewer and fewer committed to it, but you're blessed in this community to have a partner like St. Elizabeth's and Bryan LGH that are attentive to it, and a community that's willing to jump forward and help. So I think some people kind of look at hospitals and medical centers and say that's an obligation, but we really kind of look at it more as a privilege to get to work and serve in those areas, and it's only possible with great partners. So, I'm not exactly what Joe's going to talk about today, but I think you'll see some intersection with 7 points that I want to give you from a local health system perspective. And so keep this in mind as a backdrop. I know Bryan LGH is looking at this reformed healthcare environment or arena not as a political issue. It's a demographic issue for us. We have a state that's getting older. We live in a community that's getting larger rapidly, and how do you meet those needs? It's going to be an interesting balance. Number 2 of the 7 points I want to leave you with is one thing that keeps us up at night and is central to our mission is how to keep people out of hospitals, believe it or not. Keeping people out of hospitals is core to our mission, but we know most of our, not most, but a lot of our population is non-compliant in helping. Number 3, I think Kim would agree, we're trying to find ways to take cost out of the system. Yet, number 4, there's going to be more and more people to take care of, as many of them are entering their peak health consuming years. 5, technology. At Bryan LGH, you have a rich heritage of having, very high level and advanced tertiary care. But people are looking at technology now, not just to have the best and latest technology, but they're looking at it from how can it be convenient for me as well. Number 6 is publicly reported information. There's a lot of confusion out there, and there's a lot of people that are exploiting the thirst for healthcare information out there. So I know one thing we've done as an organization is we've just recently decided that we will supply data and participate in organizations that do not charge you to market the data. So HCAPS, Joint Commission, Thomson Reuters, yes, you'll see us participate in it, but other organizations that might charge anywhere from $30,000 to several $100,000 to use that data, we're not going to waste that money to go that route. We'll put every dollar at the bedside. And then 7, the last point, is we really see philanthropy being a key to the increasing needs that are going to be put upon all of us to reach our safety nets, reach all the core services that you've come to expect. So with all that, I would like to just thank you for everything you do for the community and welcome you to Bryan LGH. So.
Thank you very much, Bob. I also want to introduce the CHE staff to you all. Lori Seibel, our President and CEO. Stephanie Eels, Project Manager, back there in the corner, taking photos for posterity. And Jody Lose, our Office Manager. There's Jody. Thank you very much. Recognizing individuals who give their time and talents to our local nonprofit agencies and thereby contribute to the overall health of our community is very important to the Community Health Endowment. We provide recognition each year with our annual Horizon Award and Closing the Gap Award, our partnership with the Lincoln Journal-Star on Making a Difference ads, and our promotion of projects and grantees on our website and through social media. We hope you've taken a look at the screen behind me and seen some of the Making a Difference ad honorees who are volunteering their time and talents to our community, as well as pictures of some of our grantees and projects. On behalf of CHE, thank you for truly making a difference and helping us to realize our vision of making Lincoln the healthiest community in the nation. Please join me in thanking them. Each year, we provide a status report on the financial health of the Community Health Endowment. It's my pleasure to reintroduce Britt Miller, CHE Treasurer, to provide this report.
Thank you, Mike. Well, welcome to the annual shareholder meeting of the CHE for 2012. I say that because indeed everybody in this community does indeed have a share of this endowment. I would also be remiss if I didn't take a moment and thank the hardest working committee in the city of Lincoln, the investment committee. The number of hours that the people spend in meetings every year is incredible. The amount of talent and intelligence they bring and resources they bring makes our job a lot easier, and it certainly helps the endowment, as hopefully I will point out to you here in a moment. The Investment and Finance Committee is charged with overseeing the portfolio of the endowment in a prudent manner. I always remind people that we are an inflation-protected endowment, so we protect the original principle that stem from the sale of the hospital. While we have not been immune to the buffers of the global economic community lately, I would like to point out to you, investment people always like to look in 5-year cycles. So when you look back at 2007 and 2008, we had a balance of $54,900,000. As of last month, we were approximately $57,400,000. During that period of time, those 5 years, we also were able to distribute to the community slightly in excess of $7 million. So if there were an applause sign for the committee, it'd be on. I'll tell you this, for this year, the endowment is strong. The fund performance is for the year, June 1st, 2011 to 2012, we earned a rate of return slightly in excess of 6%. It is generally at this time, we also announce the gifting going forward. This year, we have our targets, but I cannot announce them because the board meets on Wednesday, and that's where we're going to discuss that. So check with the website afterwards, and I'm sure you'll see what the board has in mind. And with that, I'd like to turn this over to Dr. Maria Prentice-Lindell for the first of our awards. Thank you.
This is really fun for me to do, and certainly an honor. Good afternoon. I am Maria Prentice-Lindell, and it's my honor to introduce the recipient of this year's Closing the Gap Award. To recognize the important work being done by individuals and groups to reduce health disparities and to eliminate barriers in healthcare access, CHE began awarding the Closing the Gap Award. Today marks the 7th year that this honor will be bestowed upon a person or program working to reduce inequalities in healthcare, or what Dr. Martin Luther King said, the greatest form of injustice. CHE is very pleased to recognize an organization that has been working to improve the health of our community by increasing the pool of diverse candidates serving on nonprofit and governmental boards. I am privileged to announce that this year's recipient of Closing the Gap Award is Leadership Lincoln. With those in attendance representing Leadership Lincoln, please come forward, including Deanne Finnegan, President, CEO, Laura Uridell, Programs Coordinator, Todd Yorgis, Board Treasurer. Come on up. The purpose of Project All is to equip, encourage, and recruit diverse individuals for meaningful roles of governance and service on governmental and non-governmental or nonprofit boards. This program fits well with Leadership Lincoln's overall mission, which is to develop, sustain, and support civic engagement through diverse leadership so that all members of our community can make a difference in strengthening and transforming Lincoln. Since the Project All have completed the program, started the program 5 years ago, 53 individuals have completed the program and remain in Lincoln, including 10 new graduates just this month. Graduates serve on the board of directors of 17 local nonprofit agencies, have received 7 mayoral appointments for governmental and community committees, and contribute as volunteers for many nonprofit agencies. Some graduates have said that Project All has been a life-changing experience that has forever changed the way they view themselves, their passions, and their community. You can read more about this inspiring program in the insert found at each table. On behalf of CHE and the entire community, a big thank you to Leadership Lincoln for truly making Lincoln a healthier community for everyone.
I promise I'll be very brief. On behalf of Leadership Lincoln, we're very pleased to receive this award. thank you to the Community Health Endowment and the Mayor's Office for proposing the program and supporting it not only financially, but through appointments of graduates, guidance, and encouragement. Leadership Lincoln is honored to consider Project All one of our 4 core programs, and we have gained as much from the program as we've given to it. We've been able to get to know some incredible individuals we may never have otherwise known, people whose voices are contributing to and enriching our community. Will all the graduates that are in the room of Project All please stand and be recognized? And we have another group that supports this around the Board of Directors table. Will those folks that are directors of Leadership Lincoln please stand and be recognized as well? In closing, thanks to the Community Health Endowment and to the Mayor's Office for your partnership, and to the Community Health Endowment for this award. Thank you very much.
Good afternoon. While they take some pictures, I'll go ahead and get started with the Community Horizon Award. My name is Doug Gans. It's my honor to introduce you to this year's recipient of the Community Horizon Award. Back in about 1978, my wife and I, not married at that point in time, moved to Arizona, started careers, and after about 12 years there in Phoenix, decided it was time to got married and decided it was time to start a family. And at that point, we realized it was time to come back to Lincoln. There's a lot of family here, and a lot of very special people, many of you in this room, who've done a lot of very spectacular things for a great community. We talk about what a wonderful community this is in which to raise a family. My family is a great example of that. Today I have the pleasure of presenting the Community Health Endowment's Annual Horizon Award to the Mental Health Association of Nebraska, an organization that has done really some phenomenal things for a group of people in this community that are very appreciative of their work. Alan Green, Executive Director, if you'd come up and join me. Brenda Spilker. And is Jeremy Hill here with you also? Well, if you'd come up and join me. The Mental Health Association of Nebraska is a consumer-run, statewide association with a strong presence in Lincoln. They exist to make changes, to assure choices, and to promote equal participation in society for consumers of mental health services and their families. They've made a significant mark on our community by providing an array of recovery-based programs with a focus on the consumer, including the Kia House and the Lincoln Police Department referral program. I've spoken to a number of mental health providers in our community. All of them have indicated unanimously that the Kia House is a cutting-edge program, really quite remarkable. You'd probably see more likely in a community like Denver or Chicago. So we'd like to congratulate you very much on what you all have accomplished. Spectacular. So today's Horizon Award recognizes the Mental Health Association of Nebraska for their innovation, their inspiration, their forward-thinking contributions to our community, and for making Lincoln a healthier place for all. On behalf of the Community Health Endowment and the entire community, thank you to the Mental Health Association of Nebraska. Thank you very much. I'll give you that.
Well, thanks. I want to thank the Health Endowment for supporting our programs, Region 5 Systems for basically underwriting most of our programs. But mostly I want to thank our staff and volunteers who we have, if you guys would stand up. I have a couple board members. They're the ones who really do all the work. As was mentioned, our programs are very, very rare in our country, but hopefully they will be in every community if we can continue to spread the word. But it takes the support of the Health Endowment, our partners, Bryan LGH, Lincoln Police Department, and the community at large to make it all happen. So really, thanks to everybody in the room. Thank you very much.
I'll close our stakeholder or shareholder meeting here today with a number of thank yous. Thank you, Mayor Beitler, for being here with us today. Your presence here today, in a way, validates what we do here and what we do outside of this room. And I don't mean just the Community Health Endowment. I mean everybody in this room. And for that, we understand you're a busy guy and you got a lot of stuff to do. But the fact that you're here with us today is important to us, and we thank you for your presence. Lori mentioned that we have two trustees who were term limited off, Dr. Maria and Allison. And I thank you for your service. You've heard me say before, but they will be witness to it, that service on the board is an honor, but it is definitely not an honorary position. As Britt has mentioned, it might be the hardest working board in town. And so thank you to you two for your service to the Community Health Endowment and to our community. And lastly, I want to thank each one of you here today for your attendance, for your interest in the Community Health Endowment, and most importantly, your contributions to health in our community. Every community faces challenges, especially when providing health and human services to our most vulnerable, and in some cases, our most valuable populations. But Lincoln is blessed with individuals and organizations who desire to be part of a bigger solution. Folks who are committed to improving the safety net. Folks who get the importance of primary care and a medical home. Folks who understand that cultural sensitivity is not synonymous with cultural competency. And that certainly includes those of you in this room. It has been said that with great passion and a great sense of purpose, great things can happen. The Community Health Endowment is proud to be a leader on this journey to a healthier community. Thank you again for your attendance, and we are adjourned.